Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Jeanne Pinder, founder and CEO of Clear Health Costs. An accomplished journalist with over 2 decades of experience at the New York Times, Jeanne founded Clear Health Costs to bring transparency to the healthcare marketplace and empower consumers to make informed decisions about their healthcare. Clear Health Costs has partnered with news media outlets in different markets around the country to help shine a light on healthcare services pricing, garnering awards and further coverage for its work. Welcome, Jeanne, and thank you for joining me today.
Thank you so much for having me, David.
My pleasure. So I always enjoy hearing about your work and the new sort of dark crevices that you find in our system or non-system. But I'm interested to hear what got you started in this arena. What brought you from your work at the Times to working at Clear Health Costs?
Not long ago, members of my family had 3 bits of minor surgery, about a half hour each, and we got 3 sets of bills. The anesthesia bills alone for the first one were $2,000, the second one $2,000, and the third one was $6,000. So I'm a journalist. I'm like, what's up with that? I found that for the expensive one, I was being charged $1,419 for a generic anti-nausea drug that I could buy online for $2.49. So I had this long and unsatisfying argument with the hospital, the insurance company, and my employer. Everybody agreed that this is totally standard, nothing out of the ordinary. The more I thought about it, the more I talked with other people, the more I realized that nobody has any idea what stuff costs in healthcare. You don't know before, during, or after that procedure what it will cost. Only months later do you get a bill or an explanation of benefits that explains exactly nothing. So a bit after this happened, I volunteered for a buyout from the New York Times, where I spent more than 20 years as a reporter, editor, and HR exec. I was looking for my next act. And it turns out that next act was to build a company telling people what stuff costs in healthcare. I won a Shark Tank type pitch contest to do just that.
Great. And now we can benefit from this investigative journalism approach to healthcare. So one premise of your work seems to be that people will actually shop around for healthcare services. I recognize that increased cost sharing through co-payments and deductibles and co-insurance has increased people's exposure to healthcare costs, but how much of the healthcare services that we use on a regular basis, or even on an emergent or urgent basis, is really shoppable?
Actually, a lot of it. I mean, if you stop and think about it, you wouldn't really shop for an emergency appendectomy, but your other interactions with healthcare, an MRI, a blood test, a test for sore throat, vaccines, a lot of things in there are shoppable, things that you have choice over where you could go to get something. You don't have to go in an emergency. And by the way, I should add that before we go any further, I want to just set out there that this is completely insane, that we're asking sick people or people who have some ailment or maybe an injury to really look carefully at what things will cost. It's the way the system is right now, and we do suggest that people pay attention to this carefully. Otherwise, they can just get rammed.
Well, I mean, short of having a Medicare for all sort of system, and even that might not be something that insulates each of us from cost considerations.
Right.
We're sort of stuck with this crazy system or non-system that we have at the moment. So we need to continue to do this.
Yeah,
now.
And so what we've learned is that, for example, the same simple blood test could cost you $19 at one place in New Orleans and $522 a few blocks away. The same simple MRI could cost you $475 in San Francisco or $6,221 about 20 miles away. That could be you paying all of that, depending on where your deductible is. So it pays for us to understand this. Most people don't really know that prices vary so much. We assume that prices are somehow fixed or regulated. or that they don't vary quite that much. And yet increasingly people are learning they do vary by a lot.
Right. And sometimes, as you say, you don't find that out until after the fact.
Right.
So there are a variety of price estimator tools that are made available by some health insurance companies or by some larger healthcare provider organizations. Are those ever useful resources for patients?
As near as we've heard from a lot of the insurance calculators, they're wildly unpredictable and there's not really much accountability. We have heard that people have gone to use an insurance company calculator, been told that a procedure would be, say, $200, and they come out finding that it's actually $2,400. The insurance companies are still in the business of steering people towards a given provider in network. And in that regard, we think it's entirely likely, in fact, obvious that their data should be in the service of that steerage. What we do here at Clear Health Costs, we're journalists. We're not steering people anywhere. What we do is collect prices by surveying a provider, hospital, doctor, clinic, lab, on their cash or self-pay prices for a range of common shoppable procedures. We also will tell you the Medicare reimbursement rate for that in your area, which is the closest thing to a fixed or benchmark price in our marketplace, fixed by statute. And then we do crowdsourcing. We ask people to tell us in our interactive software what they've been charged, what their insurance company has paid, and what they have paid, so that you really have a 360-degree view of pricing, particularly for those shoppable procedures.
Has it been your experience that the variation for a particular shoppable procedure will be paralleled across the full range of services that a provider offers?
Yeah, in fact, and the variations are startling. We saved one woman in New Orleans $3,786 on an MRI. So she's a fairly young person. She has a hereditary condition that probably affects her now and certainly will affect her later. Her doctor recommended that she get a baseline MRI. So we should just know for sure what's going on. So she said, sure, I have good employer-sponsored health insurance. She scheduled the MRI, and then 2 days before it was supposed to happen, she heard from the hospital. They said, how are you going to pay for this? And she said, well, how much is it going to cost? And they said, how are you going to pay? And she said, I heard you say that. What I answered was, how much is it going to cost? And they said, well, what's your deductible? And she said, $5,000, but what does that matter? I mean, the price is the price, right? They said, we'll call your insurance company and then we'll call you back. They called her back to say, the good news is that you've spent down some of your deductible, so that MRI is only going to be $4,538. She said, what? So she hung up the phone. She actually happens to work at the Times-Picayune, which is one of our partners, and went over and talked to the lead reporter and said, this is crazy. I mean, is this how much these things cost? And he said, well, look in the database and see if you can find that same procedure at a different price. She came back and said, I found it at $672.86. I must be doing something wrong. And he said, no, we've heard variations like that before. I'm not totally surprised. She said, what should I do? And he suggested that she check her work, go back and re-report everything, and talk to her doctor to see if the doctor is comfortable with this other MRI provider. She went through all those steps, went ahead and got the MRI at the cheaper price, and saved $3,786. She told us that before she found the lower price, she was pretty sure she wasn't going to do it because it was just too much money. And she explained to us the relief that she felt once she realized that she could get it for a lower price. Also, incidentally, it did fall against her deductible. So the insurance company, which could clearly have sent her to the less expensive place, did not. We have thousands of stories like that.
So there seems to be a real disconnect in terms of an understanding of services, of network, of prices, and as you said earlier, it's sort of left to the individual patient or consumer to figure this out.
Which is crazy.
Yeah, it shouldn't necessarily work that way. Are there other kinds of price estimator tools that you see people beginning to build that might be more useful than the ones that have been out previously?
Yeah, we've seen a number of them. I mean, this is a known problem. We're not the first people who discovered it or tried to solve it. Some of the states have generated some sort of pricing estimators off of their all-payer claims databases that are varying degrees of usefulness. We've seen a number of for-profit companies come in with a model where they match up the patient and the provider in the marketplace and take money out of the middle for making that connection happen. We've also seen a number of businesses with that business model fail. And I think it may be because people are kind of okay with knowing that that's happening if it's something like Amazon or Kayak, but they're not comfortable with that happening in healthcare.
If you're just tuning in, this is Harlow on Healthcare, coming to you on HealthcareNOW Radio. I'm David Harlow, and my guest today is Jeanne Pinder at Clear Health Costs. So we're talking about price estimation tools and whether there are useful resources out there. And the other side of the coin is quality, whether it's healthcare or electronics or appliances or cars. When we're shopping, we're looking at price, but we're also looking at quality. Are there resources available that can help patients look at quality comparisons among providers in a useful way? Is this something that you're looking at as well?
You know, there are a ton of quality metrics out there. We don't find any of them particularly useful or actionable. When people ask me that question, I usually say if we found a good quality metric, we would incorporate it yesterday. Because people don't really want the cheapest appendectomy or the cheapest vasectomy or the cheapest cancer care. They want good value. But what we've seen is out of this welter of competing quality measurements, all of them conflicting, that none of them are particularly useful because quality transparency in healthcare is as broken as pricing transparency. So we're basically left asking our neighbors and coworkers and Facebook friends, do you have a good gynecologist? Or my friend who asked me on the train this morning, I'm looking for a physiatrist at the hospital for special surgery. Do you know anybody? I happen to, but it's really a very low-tech solution. I mean, in the face of all of this technology and all of these competing measurement systems and increasing concern about value-based care paying only for better results, we still basically have people chatting over the back fence about who's the best doctor.
And you don't see a clear winner in this department or a clear set of standards or measures that we'd like to see. I mean, I know there's a million measures, quality measures in healthcare. There's probably something north of a couple thousand in this library of quality measures that are used and, validated and verified and so forth. But they are either so narrow or, as you say, not necessarily reliable as a way to judge at the individual consumer basis, but at the individual consumer level, where to go, who to choose as a specialist for a particular service. I've often thought that it would be nice to have 6 or 8 meta measures that sort of incorporate all of these measures or predict all of these measures, and that would sort of be more easily digestible. But I still haven't seen anything like that coming down the pike.
Me either. And I think part of it is because the people who are doing the measuring, like let's say the hospital system, might have different goals from the people who are experiencing this, the patients, consumers, or as we like to call them, people. So when you try to figure out like what's good, they might be in direct conflict with each other on some level, right? You might find a hospital system that's really interested in this particular kind of treatment and in finding that 7% growth over the next year, while the patient might really be interested in, dancing at his daughter's wedding or lower level of treatment. So I think until those things are resolved, which might be never, it'd be very hard to get some kind of really good quality metrics that speak to both sides. That's my guess. I'm not an expert in medical quality measurements by any means, and I'm certainly not a trained physician.
There are some quality measurements that are being done by payers or by employers or by organizations that serve employers that are the ultimate payers, et cetera. So there's sort of a distinct approach from that perspective as opposed to from the provider perspective per se. But still, it's confusing in a crowded space.
So which ones do you like, David, as far as quality metrics?
Well, I'm just off the top of my head, I'm thinking of Leapfrog as one that would meet the description that I just gave. It's sort of presented on behalf of employers, which are really the ultimate payers for many people's healthcare services, and it's at least some sort of indicator of quality. But that's at a very quote-unquote gross level, at a service line level or at a hospital level or a hospital system level. And it may not get as granular as an individual looking for, a particular specialist on a particular day.
Right. Yeah, I love Leah Binder. I love her work. I love Leapfrog. Mm-hmm. But the point that you mentioned, I think of one major New York City hospital where I had two doctors in the same specialty. One of them probably shouldn't have a license anymore, and one of them is amazing. But how, you couldn't find that out from Leapfrog?
No, certainly. I mean, there are other sorts of data out there, but again, as you say, it's hard to really figure it out at the individual provider level. One other kind of approach to sharing information with the general public has been taken recently by the federal government. A little appreciated section of the Affordable Care Act, lo these many years later, has now been implemented by an administration that loves to hate the Affordable Care Act. So, sort of aside from that incongruity, there is the question of how this is actually being implemented. And I'm talking about the section of the Act that requires each hospital to post essentially a price list for certain services. In the time since that rule has rolled out, there's been a lot of blowback. Some hospitals are posting incomprehensible billing codes with their prices of abbreviations of procedures, and I haven't seen any yet that are really what I would call human readable, or more importantly, really likely to be useful to an individual as we're talking about seeking information about a hospital or seeking care. These are list prices from a hospital charge master, so since virtually nobody pays list price in this healthcare economy, that's problematic, and it is transparent in a certain way, but in another way, it is still just as opaque as ever. The way this is rolled out, I don't see this as particularly useful yet, but I guess the question is, do you see this as a useful first step? Does this hold promise for further regulatory action that might be taken at either the federal or state level in terms of price transparency?
Right. Well, as you point out, these list prices are really, they're pretty much meaningless to the average person. They're very hard to find on the hospital's websites. When you find them, as you point out, they're hard to decode. But if you did manage to decode it, then you might find out that the list price for that MRI is something like $4,000, and decide that that's so high that you're not actually going to get it. I mean, I've seen list prices like that for hospitals around here in the New York area. So in a way, this sort of data release could actually be harmful. We've also seen, the state of California has had a version of this for some time. There was another data dump of Medicare charges, I think 4 or 5 years ago, under Brian Sivak over at the HHS, and that didn't really affect anything either.
No, that wasn't particularly useful.
No.
Just as this doesn't look to be particularly useful.
No. If we knew that it was a first step forward and that the following steps would then take place, I would stand back and applaud if the hospitals were required to publish not only their charge master prices, but juxtaposing those prices next to the Medicare reimbursement rate, which can be like a tenth of the chargemaster price, juxtaposed next to the cash price for that same procedure, and also the negotiated rates with major insurance companies, Aetna, United Healthcare, Cigna, Blue Cross. That would be a useful data set. When you have just the chargemaster,
them's fighting words right there.
but it can be done. We know it can be done.
Right.
Because we know the numbers exist out there. They exist in various data repositories, but they're being hidden from us. And I assume that they will continue to be hidden until such time as somebody finds it useful to release them.
Well, looking to the future, let me ask you my wrap-up question, which is, if you were to wake up tomorrow and find yourself 5 years in the future, what's one thing in healthcare that you would hope or that you would expect has changed drastically?
I will have put myself out of business. That 5 years from now, we will be at a point where our successes in revealing health costs and encouraging people to insist that their hospitals, doctors, insurance companies reveal health costs, that their governmental institutions, including legislators and regulators, encourage the release of health costs. A little bit more of what we're doing, and we will have completely changed the landscape and made it mandatory for every single entity to post all prices, charged rates, cash rates, insurance rates, contracted rates, and there will be no need for us to do this anymore.
Well, that would certainly be refreshing. And as you said, there's some of this activity at the state level, some activity of questionable utility at the moment at the federal level. Do you see other states moving in this direction around the country?
Yeah, I do, and sort of small baby steps. But the truth is that, as we know, this is one of the biggest problems we face as a nation. Look, 83% of Americans said in a recent Pew Research study that high health costs were keeping them from getting health care. 83% of Americans can't agree on anything. In a CBS poll preceding the midterm elections, 66% of Americans said healthcare was their top issue. I don't know who the 17% are who don't think healthcare costs are a problem, or the others who really didn't think that was their top issue going into the midterms. This is an enormous issue. It affects so many people. We talk to people who can't afford their medications, who have to choose between paying for healthcare, paying the mortgage. We talk to people who choose not to get treatments because they can't afford it. Imagine knowing that you can afford the diagnosis and not the cure. This is an untenable situation. It cannot continue.
Well, I applaud your vision for the future of getting this information out and getting the services to people in a way that can be affordable, and you're putting yourself out of business.
It's a lofty goal. But I'm up for the challenge.
Okay. Well, thank you again for joining us. I appreciate you taking the time.
Thank you so much for having me. Thank you.
You have been listening to Harlow on Healthcare. Join us at HealthcareNOW.radio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.